Okay.
Why should anybody choose anesthesia?
Okay. Good question. Well, I'll tell you why did I choose anesthesia. When I graduated and came back to Kuwait from Ireland, I felt kind of lost. I didn't do a long elective in Galway in anesthesia. And when I came back, medicine for me was too boring. Like long rounds, long clinics.
Very long rounds.
Yes, very long rounds. Correct. Sorry, interns. And then the surgery. They were long and for me too complicated.
Right.
So and I didn't do a lot because I was a junior. Just hold a scalpel and everything. So, and then I feel like it always starts with a mentor. So I met someone, an anesthesiologist, who I started talking and then did an elective.
Right.
And that's how I got into anesthesia. However, in broader terms, after being in anesthesia now, I can say that anesthesia is, so the word anesthesia itself is just the intentional practice of putting someone unconscious. But anesthesia is a much bigger specialty.
The intentional practice of putting someone unconscious.
But anesthesia is it's a small term for a much bigger, wider specialty.
Okay.
So in anesthesia, as a resident or a doctor, as a consultant, you deal with so many different specialties. So you work with different colleagues from surgeons, general surgeons, vascular, pediatrics, obs and gynae, even medicine. So that's a huge bonus. Number two, you deal with different type of patients. You deal with pediatric, neonates, adults, and you deal with them at different stages of their lives, different moments, stressful moments, all the way from a new birth to, if you specialize in pain, to comfort measures, for example. So like completely wide varieties. It's a mix of science, applied physiology, pharmacology, that's a common thing that we say, and a lot of skill. So intubation, lines, regional, which is a huge advancement in anesthesia now.
Right.
So it's a nice balance for me, at least. It's not too much into the hand skills and not too much just science. It's applied science. And you see your results immediately. So when a different specialty is treating the blood pressure over 2 months or 1 month, I'm treating the blood pressure immediately and seeing the effect. It's so rewarding. And even when you put in an epidural for a pregnant lady and she gets comfortable immediately, it's just, I've done this over the residency over 5 years. Every time I did it, it felt good. Okay. So it didn't change.
So you still get the satisfaction now?
Yes, exactly.
So you don't get you haven't got.
I do pain now, so I still get satisfaction. And it's very rewarding, even if it's short-lived. The other thing is anesthesia is a gateway to other specialties. So when you come into anesthesia, just like any other specialty, there's regional anesthesia. Like when you go to gastro, there's IBD, advanced colonoscopy. Anesthesia is regional and stuff like that, but also there's the opportunity to be an intensivist, so go into critical care and manage critical patients, and also pain,
right? And
have your own clinic, and you have more of continuity of care with patients. And speaking of like different personalities, anesthesia, we do care about patients a lot, and a lot of people think that we're not social. To the contrary, you have to be very social in a very short period of time.
Okay.
And you have to, like a patient who's coming very anxious with stage 3 cancer, for example, coming for a big surgery, you have to build a rapport with this patient in the morning of the surgery. So that's a skill and something I enjoy doing on a daily basis. And when you go home, you still think about your patients, but you don't have that continuity of, like the chronicity of dealing with some of the issues that other specialties have. So it's some people think that it was a bonus if you're not into anesthesia.
So it's short-lived.
It's short-lived, but it's intense.
No, but that's a great thing.
Yeah,
you know?
To me it is.
Yeah, like you mentioned, the quick reward.
Exactly.
Yeah.